Thank you for choosing to watch our What to Do with a Cancer Diagnosis series. Our project consists of 6 PowerPoint videos that are available both on our National Grange website and on the RetireSafe website. RetireSafe, which advocates on behalf of seniors' rights and issues, has been our amazing partner through this entire series. Bristol Myers Squibb, a leading cancer pharmaceutical firm, has made this possible. We thank them for our sponsorship and for this series. To tell you a little bit about the project, we're here to provide you with tips and instructions that you can use now or throughout a cancer journey. We see our series as a template that can be used for any condition that you may be diagnosed with. We hope this never happens to you or anyone you know, but if it does, we want you to be prepared. If you were ever curious about what to do next, what your options were, and how to get organized, our mini-series can assist you. For those that live in rural areas, we believe this series can be particularly useful as you have to be more diligent with your care because you don't really have the doctors that you need. You're further from specialists in cancer treatments, lawyers, and caregivers, and don't always have access to broadband, and you're typically less insured. Hospitals in rural areas are closing as well. We believe this information will help you prepare. As a whole, we want you to be able to share this with the people around you and with those in your community.
Thank you again for choosing to watch this series. For this section, we will be discussing how to prepare right now when you do not have a diagnosis. We created these tips so you feel less like you have to spring into action when you are dealing with a diagnosis, which is already an overwhelming time. Instead, you can do things now to alleviate the stress later.
No one can really know if they will be diagnosed with cancer or any other condition, and because of this, it may seem unnecessary to prepare for something that may not occur. However, one thing is known for sure. If you are to receive a diagnosis, there will be a lot to do in organizing documents, scheduling appointments, and choosing treatments. Additionally, you'll most likely become stressed. We want to provide you with tips that we believe will not only be useful for any medical situation, but especially in the event you are diagnosed with cancer. Some of what we will be talking about in this section is how to prepare documents, as that is something that can understandably be done before a diagnosis and is extremely useful to have at hand during an emergency situation. In future sections, we will be talking about such things as the tools to have in your back pocket. But as those are more immediate to the proverbial appointment, they will be talked of later. To give an overview of what information should be gathered and documents created, we have categorized each document into 4 groups. Something to note is that we at the National Grange and our partners at RetireSafe created a document titled Patient File Checklist. In this document, which will be easily accessible for you to have, gives a list of what you should file in advance. To encompass these documents, they have been categorized into such groups as medical history, medication list, insurance information, and legal documents. We will begin by discussing the category of medical history. In terms of a future diagnosis, you could be preparing by having a document form set aside where you will be able to keep all of your diagnosis information as it comes to you in the first appointments. For example, you can create or download a form for yourself where you can write down questions to come with, write down the healthcare personnel you come in contact with, and any upcoming tests. This, however, would be blank until the appointment, but is something worth having. But the exact information that can be gathered now is your physician contact information and documents describing your allergies and health history. The physician contact information will be needed in order to coordinate treatment plans and for a more thorough medical history analysis. This information will most definitely be asked for, and to have them written down will save you from having to think of it all when your mind is already racing from the nature of the appointment. To expand on the subsection of physician contact information, you will want to know the means to reach not only your family care doctor, but also your other doctors, like the specialists that you see. Treatment plans are dependent on a coordinated effort between all the doctors you are in contact with, as certain suggestions from your specialist or PT may be in conflict with your oncologist's ideas if they are not in contact often. You may notice that the type of healthcare professionals have been separated in this slide. The reason is due to the fact that the left grouping can be gathered now, while those to the right are the people you would be in contact after a diagnosis. What is important to note, however, is that from the beginning, you will want to be writing down the contact information of the team treating your cancer. Knowing this now may inform you to possibly bring a pen and notepad to your appointment before leaving the house. Other information that will be useful to have written down is your medication list. We have provided a document that you can utilize to write in your current and past prescriptions and any recent immunizations. While you may think that you can remember all of your prescriptions or all of your past reactions, you may easily forget one in the moment. Depending on the drug, a negative drug interaction may result if your doctor doesn't know all that is being prescribed. It is also very important to have this written, as you may be prompted to just bring all of your pill bottles to the hospital with you, but outside drugs are not typically allowed onto the premises. My grandma, for example, when she had a stroke a few years ago, brought her medicine bag with her to the hospital. The reason was mainly to save money on drugs that she already owned from being provided by the hospital, but what is important from this story is that her bag wasn't allowed in without special permission, and time devoted to getting that permission, and she did not know the names of her prescriptions off the top of her head and how often to take them. Thus, to have a list written of all of your prescriptions can prove quite useful. Knowing your insurance information thoroughly will prove useful from the beginning of a cancer journey, simply because you will want to know it just to schedule the first appointment. But from then on, with any inpatient visit, any surgery scheduled, and any drug prescribed, knowing your insurance information will be very helpful. Besides having this information at the ready in paper or digital format, just taking the time to know the ins and outs of your insurance policy will prevent you from being deceived by your insurance company. Furthermore, you have time to study other insurance plans, and if you can and want to, switch to a different one. So, you will want to devote time to understanding, say, the pros and cons of the taxpayer-funded insurance or private-funded insurance plans at your disposal. Additionally, since you do not know if and when you may be diagnosed, you will want to plan accordingly for if you receive a cancer diagnosis after you retire, as your employer-based insurance may change at that point. As such, you may want to begin looking at Medicare, for example, if you have not already done so. Knowing your prescription plan is also important, as many current cancer approaches, such as chemotherapy and immunotherapy treatments, can and are being distributed orally to reduce the problems associated with having to go to hospitals, especially for people living in rural communities who have to travel long distances, and while we're living in a pandemic where reducing exposure is very important. And this may be something worth looking into, as different insurance plans have different coverage for prescriptions. Dental and vision insurance, too, should not be neglected at this time. Some treatments are known to amplify infections within the mouth, and visiting a dentist before beginning a treatment plan is important to identify whether you have a tooth infection of sorts. Some treatments are also known to have eye-related side effects, so you should also take the time to examine your vision insurance as well. There are other insurances too that you may not have considered, and we will talk in depth about in the next slide. Many people may not know of the other insurance types at their disposal, and to learn of them now may provide you with time to invest in these plans. Supplemental insurance, as is stated, may cover some of the costs of missing work, but is usually used to cover deductibles, co-insurance, co-payments, and other out-of-pocket expenses that aren't covered in your regular insurance plan. Disability insurance is also an option if you have an aggressive treatment plan that prevents you from working. In terms of hospital indemnity insurance, this type is used to cover the expenses associated with hospital stays. Long-term care insurance is for if you may need caregiver care covered. While it may be difficult to imagine yourself in a situation where you may need assistance, if you do not need any currently, it is important to consider beforehand. Often, when you are treating your cancer, your savings may be quickly exhausted, and little may remain for the additional fees and expenses not easily thought of that are associated with cancer. Something good to note is that if you use some of these insurance types, like long-term care insurance, you will receive a tax deduction. In terms of legal documents, many can be created before your diagnosis. To name the most important documents to be knowledgeable of, there is the living will, the DNR, and the power of attorneys. Also, having the contact information of a lawyer written down will prove useful. A living will is distinct from a last will and testament, which most people think of when the term will is used. A living will is what is used when you are, just as you may have guessed, still living. Something to note is that a living will does not need to be created, as it is only created if you have stipulations about life support. If you become incapacitated but know that you do not want to be sustained by a feeding tube or ventilator, a living will needs to be made so that the healthcare professionals know to not utilize these methods. Because of the implications of not using a feeding tube or ventilator may mean death, and hospitals are obligated to do what they can to sustain life, it is important to use specific language in the living will, as ambiguous language may mean that doctors will have to use their best judgment as to what was meant. Thus, it is important to write this document with a lawyer or doctor. A Do Not Resuscitate Order, or DNR, is another document that does not necessarily need to be created, but must be created if you believe you do not want healthcare professionals to do anything if you have cardiac or respiratory arrest. A DNR, sometimes confused with a living will, is distinct not only because it has a different form and rules, but because it is dependent on your distinct death, to be unfortunately blunt. A living will is spoken of when you are incapacitated, and only with life support's absence you will die. A DNR may speak of feeding tubes and ventilators as well, but only because these are methods that may be used after CPR or defibrillators bring you back. Something to note is that it is ultimately your choice whether you want a living will or DNR, and it is understandable if you choose that route. Because a DNR and living will need to have been written before an emergency situation occurs where it becomes relevant, and it is impossible to know when an emergency situation will occur, it is beneficial to consider writing these now if you wish to have them. Another way to prepare right now, relating to these documents, is to simply start having discussions about living wills and DNRs with family members. Often, families do not agree on the topic, and to begin hinting that you may want to have a DNR will possibly save arguments later when you are stressed and dealing with treatments. A power of attorney for healthcare, also called a healthcare proxy or medical power of attorney, is used to designate another person to make medical decisions on your behalf. While this may seem a very scary concept, as you do not want to consider a time when you may not be able to make decisions or are dependent on someone, it is something to consider. As will be talked about later in this section, it is very difficult after an emergency occurs to designate someone to make these decisions, for there is a lot of bureaucratic red tape. We will speak more on this later, but just know that it saves your family time and money if you begin thinking of power of attorneys early on. With POAs, there are important terms such as durable and springing to keep in mind. Know that these terms can also apply to financial POAs as well. To explain though, a durable POA is one that comes into effect as you sign it. A springing POA comes into effect when an event that is specified within the document occurs. Oftentimes, it is some level of incapacitation that causes it to spring into effect. There are benefits and drawbacks to both, as you may not want to sign away your decisions while you are still in a state of mind where you can make educated ones. But on the other hand, springing POAs are interpretable and not always in the favor that you may wish, especially if the language within is not completely specific. A power of attorney for finances is quite similar, in that you hand over decisions about finances to a trusted individual. Without this document, it will be very difficult for your family to be able to access your accounts to pay bills in the event you are incapacitated. And, as you may suspect, bills do not stop coming in if you are incapacitated. Something to note about POAs is that you do not have to allow them to manage all of your finances, just the ones you specify, and in this way, they are customizable. I say this as a reminder, but ultimately, whether you decide to create these documents and at what point are both choices that are up to you. For the living will and DNR, take the time to decide what you want from life. Take the time to decide whether you want to maximize the days you want to see certain events, like weddings or births, regardless of the state you may be in if you choose to stay, or evaluate whether you have lived a fulfilling life so far, or if you would be willing to be in a certain state. In saying this, I am not sharing my opinion either way, as both views have benefits and drawbacks. I simply want you to consider the reasons behind each choice and evaluate which you would rather do. With the power of attorney documents, you also face difficult decisions in thinking of whatever future state you may be in and who to select to make decisions. Again, it is ultimately your choice whether you choose to create these forms, and do not allow anyone to convince you otherwise. Now, as a recap as to why to write these early, one of the primary reasons is due to the time and money associated with getting guardianship over another family member. If an emergency occurs and you are no longer able to make decisions for yourself, such as being in a coma or in some other way mentally incapacitated, and the previously mentioned documents have not been created yet, your family will have to go through a long process to be able to make certain decisions on your behalf. And this was the bureaucratic red tape referred to earlier. To alleviate some of the stress that this would entail, you can consider creating these forms now. If you do choose to create these documents, you can be using the time you have now to be putting aside money to cover the fees associated with drafting these. You can also be thinking of who you may trust to make these decisions and whose values are in line with your own. Something else to note is that you may be eligible to have free consultations under your insurance about living wills and power of attorney documents. For all of the information that you gather in the meantime, you will want a designated place for these files. If you choose to print them, you may want a manila folder or binder to place all of these documents, and then you will want them in an easily accessible place that you can reach or someone can get to with few instructions. You may want to keep the instructions in writing on your person. You could also have these files available to you in digital format, as you are most likely to carry around your phone with you to most places. If this is the route you take, I suggest taking pictures of the documents or scanning them into your phone and creating a photo album within the Pictures app. There are also other apps that can help you write all of your information down, such as the Health app that comes with certain phones. One thing to keep in mind, however, is that certain documents cannot be used if they are simply on your phone. Hospitals place stipulations on digital files sometimes, such as the DNR. With that, this section is over, but you may be asking, what's next? In the next video of this series, we will be discussing tools that can help you better understand your diagnosis, such as what to do during the appointment itself.
This section will provide you with some basic tools to help you understand and work with your diagnosis. While your life will change, this PowerPoint provides reliable sources to learn more about your condition, advice on what questions would be most useful to ask your doctor, how to find the best treatment center for you, how best to keep track of materials and paperwork that you may need, and ways to find support groups, both virtual and in person. While the information provided here is by no means comprehensive, it is a basic overview of various safe resources and useful and trustworthy advice. This is a good place to start your journey into learning more about your diagnosis and what all is possible for you to do. And of course, these are all helpful tips that you can choose to follow or not, based upon your own preferences and comfort levels. This section is divided up into 5 segments: learning more about your diagnosis, preparing for your appointment, choosing a treatment center, tracking your medical bills and health insurance claims, and dealing with your diagnosis. First, we are going to talk about what to do right after you get your diagnosis. Often, a diagnosis comes over a phone call after a doctor's visit and is something you will be expecting. The likelihood of being told your diagnosis over the phone rather than in person is especially high for those who live in rural areas and are naturally far away from any medical care at all. This can mean that you may not have any immediate support when you take that call, and you may be caught off guard. This is something important to prevent. Therefore, if you are expecting a phone call from your doctor that may contain life-changing information, make sure you will be ready in case of bad news. There are several things you should do when you are waiting for a phone call from your doctor. Make sure that you won't be alone when you take it. If that's not possible, then make sure to have your friends or family members who are acquainted with your situation so that you can call them right after. While everyone handles shock and grief differently, having support is incredibly helpful and can really aid in your next steps. If you are called into a doctor's office, it is still important to have a loved one go with you. No one really knows how they will react to a positive diagnosis, and it is better to take precautions and not need them than to regret not taking them. It is important to make an appointment with your doctor as soon as possible to discuss your next steps. Even if you know nothing about your condition other than its name, schedule this appointment as soon as you possibly can. Throughout this presentation, there are several slides containing trusted websites that contain overviews, in-depth analysis, and discussion boards with real experts responding to your questions. These resources are just the tip of the iceberg of what is at your disposal to learn more about your diagnosis. It is important to remember that not all websites can be trusted, and that it can never hurt to double-check a fact or opinion with multiple sources just to be sure it is right. This research can be helpful, but also overwhelming. Therefore, it is useful to write down any questions you have to ask your doctor at your next appointment. This keeps your thoughts in order and provides an outlet for you to figure out what you think you know and what you need to learn more about. There is a lot of paperwork that is involved in any medical situation, and it is important that you know what you have sooner when it isn't needed, rather than later when you're in a hurry and can't find that one specific document. At this point, it can be good to get your medical history, insurance information, a list of your medications, and more that we will get into later on, and keep it organized and easily accessible. This way, there will be less to worry about as you move on in the process and treatment. It is important for you to be well informed about your diagnosis so that you know exactly how you wish to proceed in your treatment. Learning more about your diagnosis early on can allow you to take paths of treatment that may not be available depending on how you proceed. It's your health and your life, and therefore it is important that whatever decisions you make are with your full understanding and confidence. Researching your condition can often be intimidating. There are thousands of websites out there that claim to provide accurate information, and not all of them are the best resources. On these next few slides, there are several websites listed that have been proven to be trustworthy. Here we have a slide with just a few resources that are guaranteed to provide accurate information that is easy to understand. Some of these resources are more overviews, whereas others will go more in-depth into treatment options, support groups, and lead you to other trusted resources. This list consists of the most basic websites to go to, and by no means is this an exhaustive list of all the possible resources out there, but they are an excellent place to start. In addition, if it is possible for you to get into contact with an individual or community that has personally experienced the road you're about to take, it is highly advisable to reach out and ask for advice from their own perspective. There are a lot of things that need to be done before a doctor's appointment, and the amount of tasks may seem daunting. But it's important to keep in mind that the more you get done earlier on, the less stress you will have throughout the process. Organizing your paperwork and getting your thoughts in order are both extremely helpful and often are seen as useful tasks to remind you that there are so many options for you to proceed and that nothing is set in stone. Here is a simplified list of tasks that would be helpful to complete prior to your first doctor's appointment. Later slides provide resources and aid to help you in completing these tasks. There are lists of resources that can help define the best treatment center for you, lists of questions for you to take and add to bring to your doctor, advice on how to best keep track of materials and paperwork that will be necessary throughout your treatment process, and databases to use in order to find support groups near you, either in person or virtual. This checklist includes questions, writing them down that you have prior to meeting your doctor, paperwork, making sure all your paperwork is together and easily accessible when needed, research, using trusted websites to look into your diagnosis as well as possible treatment centers, and having a support system. It's important to reach out to family members, friends, loved ones, and local support groups so you have someone to talk to. These factors make up an example of a checklist to complete prior to your first appointment with your doctor. Following these steps can really help you to understand your own thoughts and feelings on your situation, as well as aid in showing any information you may still require about your situation and options for proceeding. Getting these things in order before your first appointment will allow you to more fully focus on your treatment and yourself without worrying about any paperwork or questions or possible distance from loved ones. Here is a list of questions you may wish to ask when scheduling your appointment so that you will know how best to prepare for it. Healthcare workers are used to these questions and wish to make the experience as beneficial and easy for you as possible. So there's no need to feel shy when asking them any specifics about how best to prepare to see your doctor, what you may expect, how best to make the process run smoothly, or how to get the most out of your limited time with your doctor. It's a good idea to write down a list of the questions you have prior to your doctor's appointment. While your doctor may not be able to answer all of your questions, they will make time to answer a few. so it is important to put them in order of priority. It is also advisable, once you obtain consent from your doctor, to record this conversation and take notes so that you may listen back to it later and pick up on anything that went over your head due to the medical language or just shock. Here's a list of basic questions for you to use, to add to, and to inspire you to base your own off of. This is where your research can come in handy, and you can focus your discussion with your doctor on specific worries and wishes for your treatment plan. Remember, your doctor does not expect you to be an expert in their field. That's their job. Do not feel embarrassed if their explanations are confusing to you, but instead always make sure to tell your doctor if you do not understand something. Medical vocabulary can be confusing, and it's important to keep an open relationship with your doctor so they can know how best to help you, and neither of you ends up frustrated due to a problem such as communication. It is your doctor's job to inform you of what is happening to your body. So just remember, you have a right to that information and anything else that will aid your peace of mind. Picking your treatment center is a big decision, but it often happens that it may be determined by your geographic location, especially for those who live in rural areas, or your insurance coverage. It is important to remember that your treatment experience can vary depending on where and how you are treated. Therefore, pick somewhere you feel comfortable and supported and where you believe your voice can be heard. There are several things to consider before choosing your treatment center. First, it is always a good idea to check with your insurance provider so that you know exactly what your health insurance will be able to cover. You can ask them for a list of approved treatment centers as a start to your search. Next, if you have an oncologist that you would really prefer to work with, often that will decide which center you end up going to. If you do not have a preferred oncologist, then you can first find a center that treats your specific type of cancer and then choose a doctor after that. It is incredibly important that you are comfortable with your doctor and treatment center, for they will be a part of a team that will be working incredibly hard to treat your condition, and therefore you will be in close contact with them for the entirety of the treatment process. It also is a good idea to gather advice from any experts in the field or from anyone who may have gone through this process already. This is where looking up support groups or talking more to your doctor can be helpful. While you aren't obligated to follow anyone's advice if you don't feel it's right for you, learning more about others' experience in the field can perhaps make the decision easier. And finally, location can play a key role in narrowing down your list of potential treatment centers and oncologists. Rural areas generally have less specialists living in them, and while that doesn't mean the quality of care is any less than in urban areas, it can feel like there are fewer to no options. However, virtual doctor's visits are becoming increasingly used more and can go a long way in providing additional options for those who may not be able to easily access the specialized care all the time. When you begin your actual search for your treatment center, first you need to make sure you are choosing from a pool of cancer treatment centers that are accredited. Accreditation as a cancer center is granted only to those facilities that have voluntarily committed to provide the best quality care in cancer diagnoses and treatments and are able to comply with established standards made by the Commission on Cancer. All of these treatment centers then fall into two categories: cancer centers and comprehensive cancer centers. Cancer centers carry out laboratory, clinical, and population-based research. Most cancer centers provide care for people with cancer, but some only conduct laboratory research, whereas comprehensive cancer centers carry out all of these activities in addition to having community outreach and educational programs. At these centers, it may be easier to find a community and a support group at the same place that you get your treatment. The National Cancer Institute also has the National Clinical Trials Network. This network contains researchers, doctors, and other healthcare professionals who do clinical trials across the country. There are several organizations that you can look into to see what kind of accreditation that the centers you are looking into have. Here's a link to a complete list of all of the NCI designated cancer centers in the U.S. They are organized by state so that it is easy to find the closest ones to you. In addition, the American College of Surgeons has accredited over 1,500 cancer treatment programs through its Commission on Cancer program, and the Joint Commission offers performance reports for thousands of treatment centers so that you can see exactly what you'll be getting for treatment. Here is a link to their performance report on specific treatment centers. The Joint Commission and the National Comprehensive Cancer Network are additional resources you may use to find an accredited treatment center near you, or just to learn of the standards that these centers are held to by each one of these commissions. There are several things to keep in mind in your search for the right treatment center. Here's a list of questions that can be useful in deciding which treatment center is right for you. How much experience does the center have treating your type of cancer? How effective has it been with those treatments? How close is it to your home or office? If it is far from home, does it offer a place for you and your family to stay? Is it close to airports, hotels, and restaurants? What support services does it offer? Will you have access to social workers, dietitians, and other care providers? Does the center offer clinical trials? How can I contact the office? What is the appointment cancellation policy? Will there be an inpatient or outpatient setting? Inpatient care requires that you stay in the hospital and be closely watched during your treatment and recovery. Outpatient treatment does not require a hospital stay, but instead can take place in a hospital building, clinic, or doctor's office. Deciding which way of treatment is best for you is something important to discuss with your healthcare team. It is no surprise that medical expenses are expensive, and therefore it is important that you are on the same page with your insurance every step of this process. Efficient categorization of your paperwork can save a lot of headaches, and detailed documentation of all expenses may save you money as well. Here's a basic list of paperwork, receipts, medical information, and claims you'll be making on your insurance that you should keep track of. It's important to know exactly what you have done, or has been done to you, the dates they occurred, and the doctor that pushed for a treatment, surgery, or test. This is all not just because your insurance will want this documentation, and it may save you from being overcharged or not getting the correct amount of coverage, but also so that you know everything that is happening to you. This is your illness, your treatment, and your body. Therefore, it stands to reason that you should be the most informed about all these things. This list on the slide is not exhaustive, but is a good start to your process of documentation. Your medical expenses may reach or go beyond the Internal Revenue Service minimums for the year. If so, track all travel, meal, and phone expenses related to your medical care. You may be able to deduct a certain amount from your taxes. This would be the amount of your total medical expenses that are greater than 10% of your adjusted gross income. There are several ways to track your paperwork and all the things listed on the previous slide, but it is suggested that you use more than one way just in case a backup is needed. None of these options are better than the other, and again, this list is not exhaustive, but it is a good place to begin your journey. A computer-based filing system is a good one to have if you are comfortable around technology, because then you can easily have access to your paperwork on any electronic device, and it doesn't take up space like physical paper does. However, if you are not comfortable with technology, or have the fear that paperwork may accidentally get lost through the wrong click of a mouse, then there are several other options to choose from. This option is just suggested to have as a backup, just in case a form or receipt is lost. There will be a copy that you'll have scanned into the computer. A paper-based system is exactly what it sounds like. With the paper system, you can simply use a pad of paper to record medical payments. Add columns for the appointment date, doctor's name, amount paid, insurance claim status, and other important notes. This system will mean you will get physical receipts of everything in your treatment and everything your insurance should be paying for. This also means you will keep detailed written records of all your medications, your reactions to them, and what they are meant to do, and why they were prescribed for you. Any tests done should be recorded, along with the date they were done, the doctor's reason for why they needed to be done, and the subsequent results. Anything and everything that happens should be written down and kept in an organized way so that you may have easy access to all the contents. Because it is so easy to misplace a receipt or be overwhelmed with emotion and forget to list down everything your doctor may have said, this is why it is important to have a backup of these documents, either physically or on the computer. If you have the space in your home, having a filing system, either physically or on your home computer, is a classic yet effective way to keep track of your paperwork. All of the paperwork, detailed notes, and communication with the insurance company can be exhausting and overwhelming, especially when you're undergoing treatments. This is why it can be suggested for you to ask a family member or friend, or just to hire a stranger, to help you to take care of this paperwork. This is likely to be an emotional time for you, and therefore it can be helpful to have a helping hand who can lead you through these frustrating issues and keep a clear head when you cannot. Finally, and most simply, have a calendar and use it. Keep track of the days you have treatments, surgery, start a new drug, doctor's appointments, and when payments and paperwork are due. Seeing this physically in front of you may help you to organize the rest of your thoughts easier than seeing a date written in a list. The following slides contain resources to help you deal with your diagnosis. This is going to be a very emotional time for you, and it is important that you do not get caught up in the paperwork and all of the medical decisions and forget to check in with yourself and how you are feeling. Bottling up your emotions will not solve your problems and will end up just making you feel worse. Talking to family, friends, or others who have the same or similar diagnosis with you is a crucial step that you cannot skip. It's important to have a sense of community when coping and dealing with being diagnosed. There are many coping techniques that are suggested for you to try before settling on one. Just like your treatment, your coping strategy should be individual to yourself and focused on what makes you most comfortable. It is first of all very important to maintain a normal lifestyle. This is a time when so many things are changing in your life already. It is best to not change more than is necessary. Therefore, if you have a weekly reading group, go to church on Sunday, have a poker night, or have already signed up for a PTA bake sale, there's no reason to stop doing any of these things. Remember that your family and friends care about you and want to help you during this time. It is important to keep open communication with them about how you're feeling, what's happening in your life, and anything else, all so that they can impact you in the most useful way and be there for you when you most need them. It is not being strong to hold in your feelings and put up a front pretending to be okay if you're not. You and your feelings are the most important thing to consider at this time, and being honest about these things will aid in making sure you get the support you need. Talking to other people who have a similar diagnosis or who have survived what you are going through is not only an excellent way to learn more about the path you're about to go down, but it can also provide you people who can wholeheartedly relate to. As much as your family and friends may want to help, they truly do not understand what you are going through, and therefore it can be extremely helpful and calming to talk to someone who can sympathize. Creating a blog or writing in a diary are both great ways to become more in touch with yourself, what you're feeling, and what you truly want in this journey. There are so many things happening and so much to keep track of that having some time to self-reflect and write it all out each day can really ease all that clutter in the mind and allow you to focus on what is truly important, your health. And like what was said before, everyone copes differently, and so if there's a method that you try that works better for you than anything listed here, definitely use that one. This is a learning process, and the most important thing is to just be open to how you're feeling, not to bottle anything up, and that way you can learn how to best support yourself emotionally and mentally. This slide contains resources that can be used to find a support group that is right for you. Whether you prefer it is in person or online, through typing or talking, there are so many options out there for you to choose from. Your research should not exclusively consist of these lists, but also check for groups that may exist in your local community or with an online community you may be a part of. The databases listed here can help you find support groups in your area, and the more specific support groups listed are examples of how you can customize your experience to truly make yourself comfortable. There is a group out there for everyone. And now, here's a quick preview of what you can expect in the next section of this presentation.
My name is Catherine.
The next section will discuss patient and family goals, including what they are, when to have certain conversations, tips for setting goals, and assessing your goals.
And success of this webinar series. I'll begin today by breaking down this PowerPoint into 3 main sections: the creation of goals, the implementation of them, and the success of them. But first, what are they? They are a collective understanding of patients' diagnosis, care, and treatment goals, which is crucial to the best possible care. Your final goals could be to completely cure the cancer, to keep it from worsening, or to ensure the best possible quality of life for the patient. The discussion of your goals of care should occur early and often with all parties involved in this process. Early discussion can help doctors to better recommend treatments to a patient's unique situation, which improves satisfaction and the quality of care. A treatment plan specialized for the patient will be able to greatly reduce stress on family, caregivers, and certainly the patient themselves. You may find it beneficial to reach out to survivor groups, as their knowledge may help you choose what will work best for you. I'd like to emphasize that these conversations will not reduce hope. They also should not occur only in conflict or during disagreements. How do you create these goals? When setting and implementing your goals, it's extremely important to be patient with yourselves. Success will be an uphill fight at times. There may be moments in which you find yourself farther away from your goal than you did the day before. Start small by creating daily tasks to work yourself through larger goals. Celebrate the patient, caregiver, and doctor's efforts, not just the accomplishments. Realize that your goals may change over time and be flexible to these changes. I'd like to introduce you to the SMART goal model. SMART is an acronym that you can use to guide your goal setting. To make sure your goals are clear and reachable, each one should be specific, measurable, achievable, relevant, and time-bound. A specific goal is simple, sensible, and significant. A measurable goal is meaningful and motivating. An achievable is agreed and attainable. A relevant goal is reasonable, realistic, and results-based. A time-bound goal is time-limited and time-sensitive. Some questions to ask yourselves when setting these goals. Who must be involved in the process towards this goal? What does the patient, doctor, and/or caregiver want to accomplish? Which aspects of the patient's reality must be considered? It's okay to examine the physical and emotional costs of your goals, as well as possible financial limitations, accessibility to treatment centers, and other factors which may affect your goals. When will the goal be accomplished? Why does the patient, doctor, and/or caregiver want to accomplish this goal? And how will progress and attainment of the outcome be measured? It's important to know that the success of these goals will be different depending on what the caregivers and patients would like. There are many different ways to track your progress toward your goals. I'd like to next introduce the implementation and progress of goals. Take the time to reflect upon your goals and imagine what the big picture looks like. It's important for you to see the bigger picture rather than just living day to day with no direction or motivation. When it comes to tracking your progress toward your goals, planning and organizing your time is key to accomplishing your goals. Once you are clear with the big picture, you must now plan and organize the necessary steps that you need in order to accomplish your goals. Share your goals with your spouse or a good friend. It's important to have another person ask you about your progress. When there is someone else other than yourself holding you accountable, you are more likely to get your tasks completed throughout the week. Questions to ask yourself to assess the goals you've set are: is it financially doable? Is it the right time? Have you got enough energy to achieve this goal? And how happy will attaining the goal make you feel? With each accomplishment, it's important for you to take a step back and to celebrate your success. If you are constantly looking ahead and never taking time to celebrate your accomplishments, you will most likely get burnt out. When you get burnt out, you lose the motivation to stay focused on your goals. Your success of your goals of treatment will look different for each individual situation. It could be that the known tumors are eradicated entirely, or that the recurrence and or spread of the primary cancer has been prevented. Or success could be that the symptoms have been relieved if a cure. I'd like to conclude this presentation by re-emphasizing the importance of goals. Having discussions about prognosis and goals of care with all parties involved, patients, doctors, and or caregivers, will facilitate advanced care planning, improve satisfaction with end-of-life care, and reduce the use of possibly inappropriate life-sustaining therapies. Thank you for your time today. I hope you take the time to listen to the other PowerPoints in this series to best prepare you in case you may need these resources. And a large thank you to Bristol Myers Squibb, the National Grange, and RetireSafe for helping with the creation of this program.
Thank you for joining us for part 4 of the series. During this presentation, we will be covering the different treatment options, the pros and cons of each, and if each one is right for you. As always, you may download the slides so you can reference them at any time throughout this presentation. In this section, we'll cover steps for deciding on your treatment. First, it is important to research your options and to figure out what treatments are available for your cancer and its stage. You can start with some research online by reading trusted websites and books, and by attending webinars like this one to become fully informed. Your doctor will also talk to you about your options, and don't be afraid to ask questions. There's no such thing as too many questions, as it is your right to have a complete understanding of your options. Then once you feel you understand your options, you should weigh the benefits with the risks to decide which treatments fall within your goals. So you should look at the side effects and decide whether they'll be worth enduring or just too much to handle. Also, how will each treatment affect your physical and mental well-being? So for physical, what are the physical costs of each treatment, both temporary and long-term? Some treatments can cause pain that you might not be willing to endure. Some might even irreversibly change your body. Living with pain can have a major impact on your life, so physical side effects are important things to consider. Then for mental health, how will each treatment affect your mind and emotions? Will certain options take such a toll on your body that you will lose the ability to be independent? Will your energy levels plummet? Some treatments also can have direct effects, like chemo brain, which can cause fatigue, depression, and mental fog. Mental health is not something to be overlooked and should be another important factor in your decision. And then for financial costs, investigate what types of treatment will be covered by your insurance. If a treatment or part of a treatment isn't covered, can you afford it? Finally, consider how treatment will affect your everyday life. Will you need to take days or weeks off work? How will your role in your family change? Will you need to travel for your treatment? Some cancer treatments are very intensive and may take over your life. This might be best for one person, but someone else might rather choose an option that allows them to stay home with their family and continue to work. Choosing a treatment plan is not an easy decision, but understand that there are no right or wrong answers. Every patient and their cancer is different. Ultimately, it is your choice. Now, for the rest of the presentation, we will cover different treatment options and the pros and cons of each. We will be covering 4 common types of treatment: radiation, surgery, chemo, and immunotherapy. We will then go over different treatment approaches, including options for clinical trials, foregoing treatment, palliative care, complementary and alternative medicine, and rehabilitation programs. First, we have radiation therapy. It is one of the most common treatments for cancer, with more than half of cancer patients getting it, either by itself or along with other treatments. So it uses high-energy particles or waves to destroy or damage cancer cells, and it can be administered in several different ways. So some forms of therapy use a machine that directs beams of radiation into your body. These usually take about 30 minutes, 5 times per week, spread out over several weeks. There are also options for injections or catheters. It depends on your cancer and what your doctor thinks is best. So we're going to go over the pros and cons of each treatment. To start, here are some of the benefits of radiation. So radiation therapy is one of the most popular forms of treatment because of its ability to kill cancer cells and prevent tumors from growing. Radiation can also work alone or with other forms of therapy. So for example, it is common to undergo radiation to shrink a tumor, then have surgery to remove it completely. One of the most notable benefits is that it is an outpatient treatment. This means that you go for treatment during the day, but don't have to stay at a hospital. It usually lasts no more than 30 minutes a session, so you can still enjoy your life at home, go to work, and visit with friends. While you will feel no pain when receiving treatment, there are side effects that will likely occur later. These most often include fatigue, skin irritation at the place where radiation was administered, and loss of appetite. Although side effects vary greatly from person to person, and some may experience no side effects at all. The other con of radiation therapy is the inconvenience of it. While it is an advantage that you will not have to stay at a hospital and it will take less than 30 minutes, you will have to go in for treatment often. It depends on your treatment plan, but it is common for the treatment to be delivered 5 days a week for 1 or 2 months. This may be especially difficult for the rural population. Your closest treatment center may be up to hours away. Having to make the trek there and back every day will be very inconvenient, and you may have to take off work or miss other activities to be able to get your treatment. Overall, radiation therapy is a very common choice for many patients, and it has been proven to be very effective. With its proven track record and ability to stay out of the hospital, this can be a great choice to treat your cancer. Another common type of cancer treatment is surgery. So this is most often used on solid tumors that are contained in one area. Usually not used for cancers that have already spread. So depending on your cancer and how advanced it is, surgery may be used to remove the entire tumor or remove some of the tumor to help other treatments work better. Most people with cancer will have some type of surgery, so it can be used in addition to other forms of treatment or as a standalone if your cancer is contained in a small area. Surgery can be an excellent option if you have a single mass or tumor, because it has the potential ability to remove all cancer cells in a small area, meaning you can be cured with surgery alone. It is also relatively convenient for patients, as the surgery is performed once over the course of a day while the patient is asleep. Unlike radiation, you will not need to go in for treatment every day for weeks on end. There are some significant risks with surgery, so surgeons are highly trained and will do everything they can to prevent problems during surgery, but sometimes problems still do occur. There's always a risk that a surgery could go wrong or have complications caused by the surgery itself, drugs used, or just your overall health. Generally speaking, the more complex the surgery is, the greater the risks of side effects. So some of the most common problems are just pain and infection. After surgery, most people will have pain in the part of the body that was operated on. Your doctor or nurse can help you manage this pain after surgery, so be sure to talk with them about a pain management plan before they operate. There is also a risk of infection after surgery. To help prevent this, follow your nurse's instructions about caring for the area where you had surgery. Overall, surgery is an excellent option as a standalone treatment if your cancer is still contained in one area. If it has spread, surgery can still be used along with treatments. The next option is chemotherapy. This is a treatment that uses chemical agents to destroy cancer cells. It is typically administered through a vein, by mouth, or into a muscle. In early stage cancer, surgery will often be performed with the intention of curing the disease, and then that is often followed by chemo to reduce the risk of reoccurrence. In the case of advanced stage cancer, the aim of chemo treatment is to control the cancer by controlling the symptoms. Now for some pros of chemotherapy. So in early stages, chemo can completely kill the cancer cells and cure you completely. Other times, chemotherapy is useful at controlling late-stage cancers and by slowing down the spread or shrinking cancer cells. Finally, a major advantage of chemo is its ability to travel throughout the body and attack widespread cancers. In comparison, surgery and radiation are confined to treat only one area. Now there are some risks with chemo. So first, chemotherapy can come with some pretty harsh side effects. Chemo drugs can't tell the difference between cancer cells and healthy cells. So when healthy cells are destroyed, you may have significant side effects like hair loss, nausea, vomiting, anemia, fatigue, and memory problems. Your cancer cells may also mutate and become resistant to chemo, making it ineffective in treating your cancer. Finally, you will have to go to a lot of appointments. Chemo is most often given as an infusion into a vein, often at an outpatient chemotherapy unit or in a doctor's office or hospital. It can also be given as a pill, shot, or cream, depending on your type of cancer. But no matter what method, you will have to see your doctor often so they can administer the drug and monitor your cancer. Like we talked about for radiation, this can be challenging, especially for our rural viewers. You might have to travel hours just to get this treatment, which can be a very inconvenient and tiring thing. Overall, chemo is a common treatment for many cancer patients, and it is effective, but it will take a major toll on your body, and the side effects may be difficult to deal with. The fourth option we will present to you is immunotherapy. So this is a bit of a newer option because while the idea of immunotherapy to treat cancer has been around since the late 19th century, the FDA did not approve the first treatment until 2010. But while new, it has become a very effective form of treatment as it uses your own immune system to fight your cancer. Immunotherapy basically boosts or changes how the immune system works so that it can find, target, and attack cancer cells. It may be used as a standalone treatment or as a supplemental therapy to just give your immune system a boost. Immunotherapy can be administered through an IV or catheter at an outpatient clinic or hospital, or sometimes through creams or pills at home. Depending on the type and stage of your cancer, treatment can be given daily, weekly, or monthly. It can also sometimes be given in cycles, so a period of treatment and then a period of rest. Now for the pros of immunotherapy. First, it is accessible and non-invasive. I know many of our listeners are members of the National Grange, so many of you live in rural areas. Like we talked about earlier, a major problem for the rural population is access to treatment. So you might have to drive hours just to get to the nearest treatment center. The good news is that immunotherapy sometimes can come in oral or topical forms. So you may not have to go all that way to a treatment center. Because they can be oral or topical, they are also non-invasive. You will not need to be poked by a needle or undergo any painful treatment. Just take a pill or apply some cream at home. Immunotherapy also comes with minimal side effects. It is different than chemotherapy because it only creates a stronger immune response that can kill cancer cells, but it does not harm any healthy cells. And chemotherapy kills cancer cells, but also kills healthy cells. So the side effects can be very different. Finally, you can develop immunomemory. So immunotherapy can offer the possibility for long-term cancer remission. It can train the immune system to remember the cancer cells so that if they ever come back, it knows right away to attack them. Like all treatments, there are some risks involved with immunotherapy. While we mentioned on the last slide that side effects are often less severe than other treatments, there still is the possibility for some. You may experience flu-like symptoms, weight gain, stuffiness, or swelling, but most people report these lessening after the first dose. It is also important to note that immunotherapy may take longer to work than other treatments. You will undergo regular checkups, blood tests, and scans to see whether the cancer has responded, but many people have a delayed response, so it may take a while to know whether the immunotherapy has worked. Like all treatments, it may not work. Right now, immunotherapy works for less than half of the people who try it. Or you might have a partial response. Your body might also get used to it. So even if the treatment works at first, your tumor could start to grow again. Immunotherapy is a great option to be used on its own or as a supplemental treatment. If you are thinking about going with this option, be sure to weigh the pros and cons and talk to your doctor about all the different types and options. The last 4 treatment options have been standard options available to anyone. Now we'll move into some alternative approaches and ways to manage your cancer and side effects. The first option is a clinical trial. So these are research studies that involve volunteers. They help doctors find better treatments for cancer. So what are clinical trials? There are clinical trials for every type of cancer for any stage. This is the way drugs or treatments are approved for standard use. They can study a new drug like a type of chemo or immunotherapy, a new way of doing surgery, or a combination of treatments. They are very safe as the government has very strict rules to protect people in a clinical trial. But they are completely voluntary. If you are eligible and your doctor approves, you may join one. Some of the benefits of participating in a clinical trial can include that you can try a new treatment that is not yet available to everyone. Maybe nothing else has worked for you, so this might be your best chance. Maybe you just want to try something new, knowing that there is a possibility you will benefit. You will also get care from medical experts at leading hospitals and health centers during your clinical trial. You'll likely see your cancer care team more often so that they can monitor your cancer and check for side effects. Finally, by participating in a clinical trial, you might help others who have the same disease by helping to advance cancer research. For centuries, medical treatments have been tested on people, and their participation has saved lives today. Your help in a trial may give a person suffering from the same disease in 20 years a better chance. Of course, with clinical trials, there are potential risks. As a newer treatment, it will not have been as studied and tested as much as standard ones. This means that there may be unknown side effects that could be worse than standard treatments. You also may need to have more doctor visits or testing, which require more time and travel. Like I mentioned earlier, if you live in a rural area, this may be especially difficult. Your nearest treatment center may be hours away, and your team will want to monitor and test you frequently. The constant driving back and forth could become very inconvenient and tiring. Again, clinical trials are untested. Options like chemo have been studied for years, so we have a better sense of who it will work on and how it will work. With clinical trials, there is no way to know who it will work on, so even if you hear stories where it's effective on one person, it just may not be on you. So is participating in a clinical trial right for you? Like all other treatments, it is completely up to you. There are so many clinical trials out there, so it is hard to group them all into one category. Each one is different and comes with its own benefits and risks. The most important thing is that you are completely informed. You can find out which clinical trials are available to you and talk it over with your doctor. It is ultimately your choice. You can choose to participate knowing it could help you and others in the future, or you can choose to stick with an already tested and predictable standard treatment. Next, we have the option to forego treatment. So some people may choose not to have treatment at all. So what do I mean by no treatment? So basically, you just choose not to have any treatment at all. You wouldn't do chemo, radiation, immunotherapy, none of it. So it is completely up to you. Your doctors may recommend treatment, but you have every right to refuse. Sometimes people with very advanced cancers find they'd rather treat the pain and other side effects so that they can make the best of the time they have remaining. Others might choose to forego treatment if their treatment options all cause pain that they just do not want to endure. While choosing to forego treatment can be a very daunting path, there are reasons it might be right for some. First, you can avoid spending days in treatment centers and hospitals, and instead spend your time with your loved ones and doing the things you enjoy. Without treatments, you will only need to go to the doctor for them to monitor your cancer's progression or for pain management options. There are many options for this pain management, You can do palliative, hospice, or home care, all topics we'll get into in later slides. Finally, without treatment, there is little to no financial cost. If this is a big worry for you and your family, choosing to forego treatment may be something to consider. But also know that many treatments are covered by insurance, so be sure to look into all your options before making your decision. Of course, the biggest con for refusing treatment is the shortened life expectancy. You would be accepting the natural progression of your cancer. So with no treatments to slow or kill the cancer, it will take its course and likely spread to other parts of your body. Every cancer is different, so you may live for months or for years. It depends on the stage and type of your cancer. It may also be hard for loved ones to accept. They might have different opinions for how to treat your cancer, but it is ultimately your decision, and it is important to be a self-advocate, a topic we will cover in later sections. Maybe your cancer just can't be cured, or maybe you just don't want to endure the side effects of treatments. Either way, this is an option. You do not have to think of it as giving up. You can think about it as choosing to avoid side effects and manage your pain. There are many options for pain management that may offer you your best quality of life. Finally, choosing to forego treatment is not a decision written in stone. At any point, you may change your mind and choose a new treatment to try. It is all up to you. The next few treatment approaches can be used to treat pain if you do choose to forego treatment, or it can be used to treat pain and side effects from your treatment. First, we have palliative care. This is a form of pain management that's main purpose is to improve your quality of life. So what is palliative care? Basically, it treats symptoms and side effects of cancer and its treatment. It is a very common part of cancer care and is usually recommended to everyone. It focuses on easing symptoms like nausea, pain, fatigue, and shortness of breath. It also helps you manage the stress of cancer by helping you handle the emotional side of the disease. Treatments may include medicine, nutrition therapy, physical therapy, or even relaxation techniques like deep breathing. You may also be offered emotional and spiritual counseling, as well as practical help to manage insurance, legal, or employment issues. One form of palliative care is CAM, standing for Complementary and Alternative Medicine. These are medical products that are not part of standard medical care. CAM can come in two forms, complementary or alternative practices. Complementary is a form of medicine or practice that is used in addition to standard treatments. Alternative is used as a form of treatment in place of standard ones like chemo or radiation. CAM is usually split into three main categories. The first is mind-body therapies. These include things like meditation, yoga, and acupuncture, all meant to relax your mind and body. These are more often used as supplemental treatments to help with side effects and relieve pain. The second type is biologically based practices. These include vitamins, herbs, and special diets, all substances that will hopefully help your body deal with side effects or just keep you healthier in general. The third type of CAM is known as manipulative and body-based practices and can include things like massage, chiropractic care, and reflexology. These are all practices that manipulate or move one or more parts of the body to achieve healing. Many of these options are excellent ways to relieve side effects and ease stress. Certain vitamins, diets, and practices can significantly help with staying healthy and with pain management. There are also many options that work to relieve stress. Having cancer and going through treatment can be a very stressful time, so it is good to have options to help you feel calm and ease worries. Think massage, meditation, and yoga. Using CAM can also help you feel in control. This is something you choose to do yourself, and you have full control over which diet you want to try, how often you do exercises, or which vitamins you will take. Of course, talk all of these through with your doctor, but this time you can experiment and try different methods to help you feel better. There are some CAM options that do come with risks. First, many treatments are unproven. So you might see ads or hear from friends that this special diet will change your life, or that these herbs will relieve all pain. There's a lot of misinformation out there, and many options you might hear about are not significantly studied or backed by science. Just be sure to do your research and make sure what you choose to do will do more good than harm, because some options can in fact be harmful. Try to avoid anything that does not have proven results, or at least be proven to not have harmful results. Certain supplements can even interfere with your standard treatment, causing more symptoms or making your treatment less effective. When choosing CAM treatments, work closely with your doctor. You may seek out your own CAM treatments, but be sure to tell your doctor everything that you are trying and confirm that it will not interfere with your standard treatment. Also, look for red flags. Be suspicious of any treatment that says it can cure your cancer. There is no current CAM treatment that has been proven to cure cancer. Also, be suspicious if a treatment does not have any side effects. If it were studied properly in clinical trials, side effects would be seen. Also, be suspicious of promoters who attack the scientific community or tell you not to use a standard medical treatment. Beware of personal stories that claim amazing results but provide no actual scientific evidence. Basically, do your research. Find out about the training and education of anyone supporting the treatment or using it to treat you. They should have a history in the medical field and would be most trusted if they are experts in cancer care or complementary medicines. Find out whether scientific studies or clinical trials have studied the treatment in people and what side effects have been reported. CAM treatments can be a great option that the majority of cancer patients do use at one point. Whether it's a special diet, massages, or yoga, many CAM treatments can help keep you healthy and relieve stress. As long as you do your research and consult your doctor, using a CAM treatment can be very beneficial. Finally, we have rehabilitation programs. These aren't exactly treatments, just ways to help you stay healthy and well before, during, or after treatment. Cancer rehabilitation programs help people with cancer maintain and restore physical and emotional well-being, and it may help you experience a fuller or quicker recovery. The goal is to improve your ability to function and to keep you as active and independent as possible. You will work with professionals trained in the specific area of rehabilitation that you need, and they will make a personalized rehabilitation plan for you. They may include therapy techniques, exercises, or assistive devices. You may need only a few appointments, or you may need it several times a week for several weeks or months. Appointments typically last 1 to 2 hours, and it's at an outpatient treatment center. It is a great and very common treatment approach, and really the only downside is that it will take up your time. Most people leave each appointment feeling better than when they came in, and it will help you with your recovery. As you make your treatment decision, here are some last things to consider when choosing. First, we want to emphasize that we are not recommending one treatment over another. There is no 100% right or wrong answer. Your choice of treatment is completely dependent on your goals and your cancer. Everyone is different, and any option could be right for someone, but not for another. Second, you can change your mind. Even when you make a decision on your treatment when you are first diagnosed, you can change your mind and switch or stop at any point. Again, everything is up to you and under your control. Third, take your time. While you may want to jump in right away after a diagnosis to choose a treatment, there is often no extreme rush. Do your research, ask questions, get a second or third opinion, and don't make a decision until you feel ready to. Finally, seek support. It is helpful for many people to talk through their options with family or friends you trust. Of course, it is ultimately your decision, but many do want to get others' input. We are not recommending one treatment plan over another. What is right for you depends on your goals and your cancer. Ultimately, it is your choice. Thank you so much for joining us today as we have gone through cancer treatment options. We hope you learned something useful today during this Part 4 of our 6-part series. So far, we have gone through how to prepare ahead of time, tools to help with a diagnosis, making goals, and now treatment options. Up next is Part 5. Part 5 is all about shared decision making. Now that you have some information on different treatment options, we'll go over how to choose your treatment based on your thoughts along with doctors and loved ones. We'll go over what shared decision making means, the key factors that go into making your decision, how your outcomes align with your goals, and what to do next. You can find the next part of this series on the National Grange's or RetireSafe's website. Again, thank you so much for watching this presentation today, and we want to give a special thank you to Bristol Myers Squibb, who sponsored this project.
Thank you for choosing to watch another video in this series. For this section, we will be discussing how to weigh the information from sources around you in order to make the best decision for yourself. We will be discussing how opinions often differ between people on the way in which someone's cancer journey should go. Shared decision-making first needs to be defined. It is when you take in what others and the sources at your disposal have to say to decide on the best course of action. Thus, it is their shared input that helps you make the necessary decisions. The list on this slide offers a few areas where there may be differing opinions and where decisions need to be made. When tests, treatments, and care plans are offered, you and the people around you will put forth their ideas about which course to take. Similarly, in drafting the legal documents that were mentioned before, such as the living will and DNR, many will want to share their views on such matters. The reasons why people may have differing opinions can be attributed to these factors, as they truly are factors that need to be considered before taking a certain path. For everything listed in the last slide, tests, treatments, care plans, legal documents, and insurance choices, money is the most common thing argued about, which is probably not something that comes as a shock. Insurance choices, for example, really just boils down to financial matters, but is an entity in and of itself that needed mentioning. For the other decisions, however, there is more than just money that needs to be considered. For tests, you may not actually wish to know whether or not you have cancer, as you may be content with not knowing, and as such, you do not want to be tested. Someone in your life, however, may want to identify what is happening for their own peace of mind. For treatments, much more than cost is factored into the decision, as was discussed in the section before this one. But, as a quick overview, the travel distance for the treatment and the feasibility and statistics over effectiveness factor into your decision. Additionally, whether the treatment aligns with your desires and those around you is something to consider. You or someone else may care more about the effect that a treatment will have on the quality of your life, or one of you may care more about the number of months or years you can gain from a specific treatment, and you will want to weigh which one you personally consider more important. You have to analyze how these treatment plans align with your desires and those around you. For care plans, you have to consider what your home environment is like, look into caregiver employment, or consider inpatient options. For legal documents, beyond the money associated with getting these drafted, timing and coordination is important, as often you need witnesses and attorneys, and you will have to schedule such meetings. Furthermore, with specific documents like the living will and DNR, your family may not wish for you to create these documents, as they would prefer a different outcome for you in the event that you need emergency care or life support. Thus, it is again important to know how these documents align with people's desires for you, for arguments often arise when discussing these documents. Thus, it may benefit you to be preparing your family in advance for you wanting said documents, by either hinting your opinions or having constructive discussions over these matters now, when you are healthy and emotions are not running high, as they would after a diagnosis. Now, it needs to be said that these are not the only factors that may come into play if you receive a diagnosis, but these are important and common factors. In terms of who exactly you may be making these decisions with or having arguments with, you have multiple sources providing you with information. First, you have yourself and your own knowledge of your personal financial situation, home situation, and ultimate desires for your life. You have family members who will be sharing their opinions or knowledge, or that you may wish to involve heavily in the process. Your doctor, too, may be influencing you towards a specific treatment, or giving you information to consider. The trusted websites that were provided to you may help you in your decision making. Any support group that you may be a part of also may guide your decisions. Something to note is that these sources of information are not inherently good or bad resources, but are simply the means by which your decision may be affected. It is also important to keep in mind that those around you, as well as the websites, may have varying goals behind what they want. For example, you may be wanting to see a particular event a few years down the road, like a wedding to attend, and you want to be aggressive in your treatment. Or you may want to be able to enjoy the time left without having to go through the ordeal of treatment. Your loved one may wish for you to have the best quality of life and not wish for you to go through the stress. Or they may wish for you to take an aggressive course of action to fully eradicate any cancer cell. Your doctor, too, may have varying opinions depending on the situation, and may wish to eradicate everything, or may not wish to burden you with undergoing a treatment plan. Those in your support or survivor group may have had a good or bad experience with a particular doctor, treatment, or insurance company that may not necessarily translate to your life. Websites, too, may have a goal. Some cancer websites specifically may be advertising a particular treatment because that is what they specialize in, or where their donors come from. Now, I don't wish for you to believe that these websites that advertise a specific treatment are being nefarious. They simply wish to inform you about one treatment type in particular. Furthermore, it should be noted that some websites may be emphasizing a treatment or insurance type on accident. Even the trusted websites may have a longer section devoted to a particular treatment or insurance, not because they think these are better or have had more research devoted to it, but simply as an accident of proportioning their website. And on accident, you may be influenced subconsciously to pick that particular treatment. Therefore, it is important to realize the goals and intentions behind where you gain your information, whether it be a website or someone you know. It is important to stress that the decision is up to you in the end, and your opinion matters. It is technically you who will be receiving the treatment, your time devoted, and probably your money spent. It needs to be emphasized that the term shared decision-making relates to you merely listening to what others have to offer and understanding how their shared inputs can help you make the decisions. Regardless of if you truly allow the people in your life, like the doctor or your loved ones, to help you make the decisions, it is your choice to allow them to have that say in your life. It is also your decision if you choose to allow a designated person to make the decisions on your behalf via a power of attorney, or if those around you vastly differ in their opinions, and after listening to their ideas, you still wish to pursue a different course of action, it is your decision. Because it is your decision and your opinion matters, people should listen to what you have to say. While many people probably do listen, it helps to know how to recognize if people are not listening to you. We've listed some ways to recognize these situations. They may be the ones to decide how the conversation is flowing. They may be prone to interrupting you. They may get defensive and overreact, may seem bored or distracted, change the subject at a point that doesn't make sense to you, or they may have no response verbally or with their body language. When it is obvious that someone is not listening to you, it is important to keep in mind some conversation techniques, as they may prove useful to getting your point across. You will want to explain your beliefs and the emotions that you are feeling clearly with them. You will want to show appreciation for their opinions and emotions, for if you take the first step, they probably will extend the same to you. You will want to keep an open mind, because their opinions may be valid and quite useful to you, and you will want to listen to them as well. You should be willing to change your opinions on matters, but if something really is non-negotiable, it is okay not to compromise on it. You obviously find that belief extremely significant, so it is worth arguing over. Also, if someone is not listening to you, it is okay to make changes. These changes can relate to your healthcare team, your support system, or the agent that you designated. Regarding the healthcare team, you can talk with a social worker or hospital patient service representative if you are having a problem with a particular person. You can change doctors or hospitals completely as well. While I make this sound easy or what you should resort to immediately, you will want to make sure you are making these changes with a clear mind. Referring to the previous slides, you may want to evaluate whether you have been listening to what they have to offer as well, and whether you are examining the situation with an open mind. Afterwards, of course, you should make the appropriate changes that benefit you most. With regards to your support system, in the end, you may have to make some decisions when it comes to family involvement, and either ask someone else to accompany you to appointments, or talk with someone else in the family about the situation, among other ideas. Again, it may help to utilize the conversation techniques from the previous slide so that you and this person may come to a compromise before vast changes are made. However, if it is necessary, you should definitely consider making these changes. Regarding an agent or representative who is not listening to you, and you have reviewed whether you are acting in a clear mind, you can work to get the power of attorney revoked. But be aware that this involves money and bureaucratic red tape, but should definitely be pursued if there is a problem. Some takeaways are that you shouldn't be afraid to ask questions of those around you, whether it be your doctor, loved one, or support group. You also want to review the pros and cons of each option, whether that be tests, treatments, care plans, documents, or insurance, before changing members of your healthcare team, or the involvement of loved ones or a power of attorney agent. Lastly, you want to make the decisions that seem best for you, and branching off that, if what's best for you is actually what's best for your loved ones, then you should evaluate and make that decision as well. This section, as you may have noticed, incorporates some of what was learned in previous sections. In the Preparing Ahead section, you learn that you can gain assistance with insurance and legal information. This assistance may come in the form of an attorney offering you suggestions, or a consultation with an insurance company, or giving over the process of decision-making to the representative of your choosing, with a power of attorney for healthcare or finances. In the Tools to Understand Your Diagnosis section, you learned how to seek out trusted websites and survivor support groups. These two resources will naturally influence your decision-making during your cancer journey, and should not be trusted outright or disregarded either. In the Goal Creating section, you learned how to understand the goals of the people around you and how to process through your own goals. In the Treatment section, you learned how to organize the pros and cons of treatment decisions. Combined, these sections help instruct you on how to take in information from everything and everyone around you to make the best decision for yourself on your cancer journey. With that, this section is over, and you may be asking what's in the next video. In the next video of this series, we will be discussing patient advocacy, which will cover such topics as groups that can advocate on your behalf,
Part 6,
and how to advocate for
become a
yourself
patient
after a
advocate.
cancer diagnosis.
Feel free to download these slides and use them at any time. Becoming a patient advocate can not only benefit a specific patient, but future research for the disease as well. Once a patient is diagnosed, they may not know where to start. Patients should know that they have access to different support groups, mental health groups, and advocacy organizations. It can make the diagnosis easier when asking medical questions, looking for support groups, and learning about their newly diagnosed disease. Advocating for yourself is one of the most important things when looking at cancer care. Once a patient becomes diagnosed with cancer, many different treatment options and choices are presented to them. The patient may become overwhelmed and not know where to start after receiving a diagnosis. They're going to have a lot of questions and may not know who to ask those important questions to. Asking your healthcare provider questions can ensure that you are comfortable and have a good knowledge of what is going to happen within the treatment. This also can be done when researching advocacy support groups, certain doctors or cancer care centers, and any other questions that you may have along the way. They are there to make the patient feel comfortable and cared for. They also want to make sure you are utilizing these resources. Some of the services healthcare centers offer are listed, such as mental health services, support groups, and other cancer patient and nutrition exercise groups. These will be offered through your cancer care center, and never be afraid to utilize them. Self-advocacy is one of the most important things to stick by when you're diagnosed with cancer. By attending the support groups and educational sessions, it can help teach you how to advocate. Don't be afraid to ask questions like financial support, transportation to appointments, and childcare services. Many cancer care centers provide these amenities. Prepare a list of questions in advance, take notes when speaking with your team, and speak with your doctor to know how much information you would like to receive up front. Don't be afraid to speak up when you don't understand or you have a question. Buddy programs both offer one-on-one support not only to the patients but their family members as well. They make sure that the family and caregivers both understand the treatment that the patient will be going through so they can be there and care for them during this hard time. Having other family members familiar with the treatment can also help them when the patient becomes stressed or has questions. Listed are some patient advocacy groups that you can utilize when finding out when you are diagnosed with cancer, such as the Patient Advocacy Foundation, the National Association of Healthcare Advocacy, and Society for Healthcare and Consumer Advocacy. They are here to help patients know their treatment options and help them answer any questions that they may be asked. The main goal of these organizations is to advocate in the name of the patient. Large-scale involvement includes advocating for public policy and connecting with legislation to increase the advocacy within Congress and their legislators. You can also hold fundraisers and participate in events that help raise money for cancer research and patient care. Educating others about cancer can also increase the advocacy and the awareness. Listed are some references that you can use for this PowerPoint.